Welcome back to Tar Heel Talk. I'm Sonia Williams. We're talking today about sleep apnea and other sleep-related disorders. With us again is Lisa Firestein with Active Healthcare, which specializes in helping sleep apnea patients. Lisa, thank you again for being with us today.
You're welcome.
Now, before the break, we were talking about what you call sleep hygiene, and I want to, if people are just joining us, just talk a little bit more about that, because that's something that I think we all can use, whether or not you have a diagnosed sleep disorder or you just really do need to get a good night's sleep. Remind us again about that sleep hygiene.
Well, the highlights for sleep hygiene is going to bed at a regular routine time every night, even on the weekends. Keeping the bedroom for sleeping and maybe some other things only. So keeping your work, TV, computer out of the bedroom. Keeping your bedroom quiet, dark, and cool. And those would be a lot of the highlights of sleep hygiene.
When you're talking about treatment options for some other sleep disorders, you mentioned insomnia. I think a lot of people can suffer from that from time to time. What options are available to them?
Well, the first option for an insomniac is to really think about some of the issues that might be keeping them awake. And for many of us that live such hectic, busy, dual lifestyles, stress management is going to be the #1 option. And that might be talking to a loved one, a counselor, a therapist, a psychologist, to help somebody get through those tough times in life. And when those options don't work, and I should say, to begin with, you always want to think about a healthy lifestyle. So eating well, exercising, trying to limit your carbs, hydrates, and your sugars are always a great thing to do to help in any situation. And then if the eating well and the exercising doesn't work and the talking with somebody, then you might want to seek out help from your healthcare provider and think about a temporary medication that can help for insomnia. And we all know there's lots of different medicines out there, but that's typically used on a temporary basis to get one through the stressful period in their life, because insomnia typically is a short period of time.
And what you were talking about with sleep apnea is it's something that you will have probably for the rest of your life. Talk a little bit more about some other treatment options for sleep apnea.
Well, as I mentioned, the gold standard is PAP therapy, positive airway pressure therapy. And if that does not work for somebody, then some of the other treatments are dental appliances, where a dentist specially trained in sleep medicine can make a appliance that one wears at night to help keep their jaw and their tongue from kind of forward so that it doesn't close up at night. And again, another possible option is surgery, and that would depend on the individual and if they were a candidate. So an ENT, an ear, nose, and throat doctor, is the specialist that would one would consult to have a thorough physical evaluation to see if that would be a possible option.
Now, Active Healthcare has 2 screenings coming up, free screenings for people, sleep screenings. Talk a little bit about those and when we can actually participate in these screenings.
Well, the screenings will be occurring on the March 24th, Tuesday, March 24th, in our Clayton office, and Tuesday, March 31st in our Durham office, and they are from 5 to 7, and we specially designed them at that time so folks can come with their families. We will have dinner. We want to make it easy for them, and they will be greeted by our nurses and respiratory therapists that will be available to discuss sleep apnea. We'll also be available to give out a risk assessment tool that will screen for sleep apnea.
Okay, and people can register for this by going to sleep@activehealthcare.com or calling 919-870-8600 extension 200, so they do have an opportunity to reach you and register for this in advance.
Yes.
Okay, we have just a few seconds left. Any final advice for people who may be having a difficult time sleeping?
Well, you don't have to do it alone. There's lots of great resources and help out there for you. And just remember, sleep is as important as diet and exercise.
Certainly some excellent advice. Lisa Firestein with Active Healthcare, thank you so much for being with us today, and thank you for offering people some free help.
My pleasure. Thanks for having me.
Okay. That's it for this edition of Tar Heel Talk. To comment on this or other episodes of the show, send us an email at tarheeltalk@fox50.com. I'm Sonia Williams. Thanks so much for watching. Enjoy your week.